Hello anatomy students, this is Rob Swatsky, and let's finish our review of the coxal bone. The coxal bone or the hip bone. We have a couple new features to consider, and we'll also review some of the previous structures. Remember, the coxal bone is made up of three fused bones. We have the superior ilium. This is the anterior pubis. And that leaves our posterior ischium. Our new structure is this cup-like socket called the acetabulum. Acetabulum means cup of vinegar. Vinegar is acetic acid, and it reminded the anatomists of the shallow cups they would use to serve vinegar at meals. The head of the femur articulates here in the acetabulum. It's connected to the coxal bone by a ligament, and it allows the tremendous range of motion as this ball and socket joint permits: flexion, extension, adduction, abduction, and circumduction. So we have the full range of motion here in this very important synovial joint. The other new feature we can see from this more posterior perspective is located on the ischium. Notice some of the rough areas, these little rough bumps and patches here. These rough regions are known as the ischial tuberosity. And the tuberosities are essentially regions where we have connection between the coxal bone and the strong gluteus muscles. So it's a kind of a roughened attachment point for the muscle tendon to grip the coxal bone. And let's do a little bit of review from this perspective. Remember our spines and how important it is to distinguish anterior from posterior. This is the posterior superior iliac spine. This is the anterior inferior iliac spine. This is the anterior superior iliac spine. And this little bump is the posterior inferior iliac spine. This is the iliac crest at the top of the ilium. This is the ischial spine. This large notch is the greater sciatic notch, and this smaller notch under the ischial spine is the lesser sciatic notch. This largest of the foramens is the obturator foramen. And let's take a look at this lateral perspective of the coxal bone. Nothing new to add, just some review. First of all, this is lateral, superior, and inferior. This is the posterior with our ischium, and here we see our pubis, anterior, pointing out in front, and our ilium, superior. So that means, in terms of our spines, this is the anterior superior iliac spine, and this is our anterior inferior iliac spine. Of course, the acetabulum and our obturator foramen.